Western Carolina University is a regional comprehensive university, and the ways that that is manifest in terms of our mission is through our service learning programs, and that is how we connect students and faculty with our local community to help solve problems in the community. We have administered over 10,000 vaccinations, and so that's a really significant contribution to the community to be able to administer that many vaccines in less than 2 months.
Our main goal from the beginning has been to get as many residents as possible vaccinated against COVID-19. So Western opening up a regional clinic has helped us in reaching that goal. The county had a pretty big wait list from the beginning of folks that wanted a COVID-19 vaccine, and WCU's clinic has been instrumental in helping us clear out that wait list.
We knew that we had to contribute because this is our community, it's where we live. We knew that we had resources, we had people, we had drive and initiative in order to get this done. As a regional university, we contribute to the overall well-being of every person in this region, and arguably every person in the state of North Carolina. Everybody on this campus has played a part. It was a Herculean effort from the folks in facilities before we even knew it, the guys in facilities, after we had identified the clinic location, they were up there rearranging furniture, laying some carpet down, creating barriers and stations, and it was hundreds of people who were involved in this effort, and we couldn't have done it without them.
In order to fulfill the Center for Community Engagement's mission, the role that we've been able to play in helping set up the vaccination clinic here has been primarily focused on volunteer management. WCU's volunteer database has really been useful in helping serve the public and the clinic. And the way that that's been managed is we've solicited volunteers, and we've had nearly 700 volunteers register with us through our onboarding process. These are students, faculty, staff, and community members, each one with a slightly different onboarding process. And we've been able to put nearly 300 of those volunteers to service work in a non-clinical capacity in our clinic. And that's been a really valuable resource for us to have access to here in the center, because not only has it helped serve our clinic with nearly 300 volunteers, we've also been able to leverage that database as a resource across the community where there are other vaccination clinics who need non-clinical volunteers. So for example, Haywood County Emergency Services, the International Friendship Center in El Centro de Amigos, right? Vecinos, we've done a partnership clinic with them here on campus. This was par for the course for how we engage with our community. And so when you can create those synergistic partnerships, I think you see things like our clinic come to life. And I think that that is just one of those beautiful reciprocal relationships that can be so powerful.
Vecinos is a free and charitable clinic. We serve uninsured patients with primary care and mental health care, as well as enabling services like transportation to medical services and interpretation. Partnering with Western on the COVID vaccine itself was really important because it's a space that our patients are already familiar with since they come to Western's Harris Clinic for their primary care. And the Western staff was critical to helping us have a successful event from planning to implementation and after.
This is probably the most important thing we will ever do as a campus, to think about every 100 years, if you think about a once-in-a-century pandemic, it could be the most important thing we do for the foreseeable future.